because we feel that building a product anyone can build now, and faster too now. With AI helping you writing codes, tech team could deploy.
Even you can do that.
Yeah, even a non-technical could do that.
So 5 years is a long time in a startup. Most don't make it, but we did. Congrats to all of you. You've been here since day zero. Vireak, please take us to the very beginning, how it all started.
Well, first of all, thank you for the questions, and just want to introduce myself also. My name is Vireak. I'm the CEO and co-founder of PillTech. I'm a US trained pharmacist. That's my background. So how it all started. So when I first came to from the US back to Cambodia, family asked, "What do you want to do?" And the only thing I know how was pharmacy, right? So I wanted to open pharmacy back then, and it was a big shock because when we first moved here, buying products for the pharmacy here was very difficult. So in the US, if you look at what we have in terms of the industry, there's one big player or a few big players. You buy everything from them. They deliver. They have 20,000 products. You buy everything online. You don't ever talk to any sales reps, and it connects to your POS system, point of sale system. So it's quite easy to place order. You order today before 7 p.m. They deliver the next morning when you first open your door, right? So that was what I was used to. So when we first, opened up our own pharmacy, we're like, where do we buy from? Who are the distributors for this product? So that was very challenging. You have over 500 different distributors, wholesalers, parallel importers. There's so many different choices to choose from. And not only that, you have a lot of substandard medication, parallel import items. You have a lot of potentially fake products as well. So I think that was a lot of complexity that we had to deal with. And the more that we looked into it, we thought that, especially in Cambodia, patients see their pharmacist first. And if you really want to take good care of the patients, you have to make sure that the pharmacists, one, they buy from legal channels. Two, they're very knowledgeable at what they do in terms of day-to-day operation or their knowledge in pharmacy, right? And three, we want to make sure that they use technology to help improve their daily operation as well in terms of inventory, stocking, things like that. So I think that's sort of how it all started was just to try to solve our own problem. But at the same time was, how can we improve the healthcare segment, especially in the pharmacy industry? So I think that's sort of the long story short on how we started.
Yeah. Over the last 5 years, what was the hardest year or moment that we encountered?
Last 5 years, well, the hardest thing, I think every year it has its own challenges, honestly. Just like playing video games when we were kids, every stages has different boss, and every boss has its own challenges. You have to test, and you have to try, you have to die, you have to try again. But I think in startup, it's very similar in a sense that every stage of the level that we were at has its own different challenges, and we've learned a lot through it. I think that's the beauty of the startup is you have to be able to learn quickly, to listen to your customers, to adopt new trends, to try to solve real problems. So I think different challenges, different year, but we definitely learned a lot in the past 5 years.
Can you give us like a specific sample of the challenges?
The challenges, yeah. Yeah, I mean, for example, when we switched the different models from being a marketplace to owning our own inventory, that was a huge challenge that we had to face, right? Because you have to deal with inventory, you have to deal with warehouse, logistic, and that is a beast on its own. And we didn't really think it was that difficult until we go into it. And it's not only tech, but operational as well. So I'll leave that to our COO She'll tell you a bit more on the difficulties, but I think that's definitely one of the biggest challenge that we faced.
Regarding to Vireak mentioned, it increased complexity when we change the model and how that affects our operation.
Thanks for the questions. Before that, allow me to introduce myself. My name is Sina, the operation at PillTech Solutions. I'm more focused on the translate the strategy into operations, within procurement, warehouse management, logistics, and customer service. Yeah, it's quite a big change during that time because after many years working closely with the pharmacy, we noticed that marketplace it helping them to order the medicine, but at the same time they also need to order from many suppliers at the same time, different timing of the delivery, and also complexity of order management. So that's the reason why we pivot ourselves to a wholesale distribution model. So we need to manage our inventory by ourselves, build strong relationship with the supplier, improve our warehouse and logistics. At the same time, the internal team also very important because they need to understand that we are moving from light asset to operational intense model. Which we have to work very closely with the customer at the same time also with the internal team to understand our new process flow, new operation, new SOP and new systems which support like
Sakada, how did the PillTech system come about? Can you share the origin story and what the lesson from day one, the first version, how we learned from the tech point of view?
Thank you for your question. It's kind of interesting question. Before I answer your question, let me introduce myself. My name is Sakada. I am one of the core team at the PillTech, and I lead the tech team. And our focus is to be a product that matters to the customer, not just we think it should exist, right? So back to your question, how did the PillTech system actually come about, right? So I think Vireak already mentioned it already. Right? It came about because we want to solve our own problem. Like he's mentioned, in Cambodia and the US is a completely different story if you open up a new pharmacy, right? When you open up the new pharmacy in the US, you just deal with only one supplier. Every time you want product, you log into their website, you add to cart, you submit an order, and you will receive your product the next day. That's simple, right? Cambodia, completely different, right? If you imagine that you open a pharmacy in Cambodia, in Phnom Penh, and you need medicine. So what do? Right? You may search the supplier online, maybe you call to the sales rep, or even physically go to start the bank just to find what you need. It's frustrated, right? It's fragmented, right? So, and then we ask ourselves, what if a pharmacy can do all kinds of that thing from one place? That question becomes the ordering we want, right? The ordering we want is just a B2B platform, a marketplace. We don't own product, we don't manage inventory, and we don't manage delivery process, right? We just provide the place that connects pharmacy to the supplier, just like that. And we launch our V1, very minimal on VP, right? And then we go through a lot of trial and error, and after we run quite a while, we got a lot of feedback, positive and negative along the way, and we try to solve it. And we noticed that pharmacy love that app. They can browse the product on there, but they don't buy much. And then we try to identify why they don't buy a lot of product, right? Because we put a lot of product on there that they just order once a month. So we try to identify what is the problem, right, on that end. So we found that the pharmacy sometimes they doesn't know what to buy for this week or this month. That's the problem, right? First problem we provide the platform that they can come in and they can sprout a product, whatever they want, wherever they want. But the second problem is they don't know what to buy for this week, for this month, something like that. So they not buy that much. And we also found that we don't have any strategy that lock them in the first place, which means that our customer can leave us easily because we just the marketplace, right? We just based on that problem we think, and I remember that day. There were 3 persons in the small meeting room. Vireak, me, and a Korean guy, a Korean senior software engineering. He originally have designed the platform, and we discussed about the feature based on that problem that we found, right? And then after Vireak finished, the Korean guy, he said, "Vireak, I have a question. I got a question." And Vireak, "Oh, good, go ahead." And then he asked, what is your killer feature?" I heard that for the first time. I feel like, wow, what is that? I don't know what does it mean. I don't know, and I can feel that at the time my eye got bigger, right? Because I curious about it. And then Vireak answered without hesitation, "Generate order." And then, what? Generate order, right? And then he explained, think about it. If you have 1,000 product in your pharmacy right now in Cambodia, in Phnom Penh, how do you restock it without a system, right? You may walk around the shelf, you count it by hand, you do the math, and then a few hours later, you conclude you need 20 products to restock for the next week, right? For the next 10 days, right? And then it's time consuming. It's boring because you need to do it every single time, right? And imagine that you have a system, and that in that system there are the button called generate order. You click that button, and it's gonna give you instantly list all the product that you need with the calculated quantity, exactly what you need for the next 10 days, right? And then you click another button, submit an order, and you're done, right? How easy it is, right? You turn the headache into a button. Okay? You turn a few over to less than 5 minutes. You turn something that hard into easy, right? And then, but here's the thing. Without data, the generate order button it's useless, right? Because we need the data. This thing that lead us to start the PS system. Because PS system, we track every sale, we track every product, we track every day, track almost everything, right? Every operation in pharmacy. And based on that data, we can build the generate order feature. So we start the PS system, and then we link it with the ordering system at our B2B platform, and we link it together, and it make buying process simple, right? And that it how we start our V1 ordering platform. We build the killer feature because we found that a pharmacy they don't buy much, right? They don't buy much. Mm-hmm. And then when we build it and we introduce it to the pharmacy, what we see is the order amount increase, right? Because the procurement become easy for them, right? they just click the button and submit the order, right? And the impact is we increase our order volume.
Let me go back to Monsignor. After the pivot, what did we build operationally afterward that now give PillTech an edge as we scale?
Well, for the operational advance is combined between fulfillment, procurement, and also PillTech tools that can bring us more advance and to bring forward to scale our business. Because we work very closely with pharmacy, so we understand, we work very closely with the pharmacy on the procurement, because Sakada also built some things that can make their procurement easier, POS and link to ordering systems. So this one also like the key killer for us, but at the same time also, it's also our advanced PillTech that we are more unique. And because we are working very closely with the pharmacy many years, so by using our product procurement, POS system, and also other tools, so this make us more manage on inventory better, so we can provide them the efficiency of the supply chain and so also reliable our operations, reliable on the fulfillment process. So they like just come to PillTech, then they can manage their inventory better, order better, and also more reliable on our service.
Thanks, Shubong. Let me go back to Sakada. What forced us to go beyond just building a simple ordering app, and how that increased complexity in terms of from tech point of view, and what people outside the industry underestimate about pharmacy tech?
Well, we have ordering platform, marketplace, right? And then we build POS, right? And Sina already mentioned about we transit from the B2B marketplace to the wholesaler, right? And it's not that simple because our system not designed for that from the first place, right? So, but before I talk about the system, I want to recall a little bit why we transit. When we run as a B2B platform, as the marketplace, we not fully manage end-to-end supply, right? The problem is sometimes the customer they don't do their job well, right? Sometimes they cannot fulfill the order, and sometimes the supplier delay the order, and it leading to the customer frustration, right? Because we cannot manage the supplier at the time, right? And then we think we cannot keep it that way. We should play our own game, right? And then we decide to change the business model from the B2B marketplace to wholesaler, right? We want to deliver what we promise to our customer. I mean, if you in the Phnom Penh or in Siem Reap, you order today, you will get your product within 24 hours. Right? And if you in another province, you will get your product within 48 hours. Right? That's what we want. Right? We not just want to sell, we not just want to provide the place for the pharmacy to order product, but we want to control end to end to make sure that everything works well for them.
Thank you, Bong. Let me get to Bong. Can you give us an outward look in the next few years or 10 years? If PillTech have done what we set out to do, what different about how a Cambodian pharmacy operate if we succeed in what we set out to do, like in the next few years or the next 10 years?
I think for us, it's all about, I think the product that we have with the AI revolution, right? With the AI innovation, it's a lot faster to build products now. But I think what our mode should be is how do we add values to the customers, right? The pharmacy customers. So I think this is something that we are looking to improve in the next 3 to 5 years or in the future, because we feel that building a product anyone could build now, and faster too now. With AI helping you writing codes, tech team could deploy.
Even you can do that.
Yeah, even a non-technical could do that. So they could deploy at a speed of light. But I think what we need to focus on is how do we add values to the pharmacy customers and really focus on that, I think. And I mean, for us, in the next 10 years, what we hope is we're able to provide so much value for the pharmacy customers that they stay on with us and they work with us, we build good relationship with them. And we hope that with the values that we added, the pharmacy owners or the pharmacy customers will be able to improve their daily operation, will improve their knowledge in terms of pharmacy knowledge, right? To better care for our patients. I think that's the end goal of where PillTech wanted to be, because at the end of the day, it's all about patient care for us, right? And I think patient care comes from different angles. For us is indirectly, we want to make sure that the patients are well served, regardless of where you're at, whether you're in the city, whether you're in the provinces, whether you're in the rural area, you should have access to quality, affordable medicine. And if we want to make sure that they have access to quality medicine, they as in the patient, we have to make sure that the pharmacy have the right tools, the right medicine, the right tools in the sense that they could list that they could buy essential products at their fingertips, to ensure that they have systems in place to help manage their inventory better. So I think those are just some of the things that we want to achieve in the next few years. Yeah.
Why us? Why are we capable of solving this fragmented supply chain?
I think it's the passion and the drive behind it. I mean, for me, I come from a healthcare background, right? Pharmacy. So when you're in healthcare, you always care about the patient. And from a tech startup point of view is, yeah, you care about patients, but how can you leverage thousands of pharmacies in the country to help achieve your mission and vision, right? So I think if we go directly to the patients, it's going to take a very long time and a different model, different products we have to build. But when you leverage thousands of pharmacies across the nation, it's a little bit easier. But of course, different products has to be built. But at the end of the day, is how can you improve their day-to-day operation by building a technology that they will use, right? And sometimes we pilot a lot of things that didn't go out to market because we didn't think that it helped solve their problems. And the problem that we want to solve is how do we increase their speed, efficiency? How do we increase their knowledge? Ensure that at the end of the day, they would have more time to spend with the patient. And that's our ultimate goal for PillTech.
Oh, wait, you mentioned about the project that we deploy that doesn't work. Does those give us any key lesson that we can learn to be better, to improve ourselves for the next thing?
I think products that didn't work, like for example, we tried the B2C, right? Online, we call it Healthtech.com, right? Basically, during COVID, we built a channel where we work with the government to list COVID test kit, to list COVID medicines on our platform where end users, patient could buy directly. And at that time, it was unfortunate and also fortunate at the same time. Fortunate in the sense that there's proof of concept, there's traction, there's lots of people ordering because there was demand, right? Because people couldn't travel and they need these kind of things. So unfortunate in the sense that we didn't know that, in the hindsight, we didn't know that this is something that in a million years that you only see it once in a lifetime, right? Where people could just like, oh, well, what I'm trying to say is we built a product and there was a proof of concept by accident in a way, because when COVID ended, the product was not in demand anymore. Pharmacies are everywhere, so we're not really solving any problems. So I think that was one of the product that we built, and we now killed it because we didn't think it adds so much value to the patient. And at the end of the day, is how can we increase value for the patients? And then we keep sticking to the pharmacy owners because they're everywhere. The access to the pharmacy is everywhere across the country. So I think this is where our North Star, and we're aligned now that we have to make sure that we focus on building values for the pharmacy owners so that they could in turn be better at what they do. And when they're better at what they do, they list more essential products. They drive more impact for the patient that living in their communities. So that's now our North Star, and we want to keep focusing on that.
What would you want an investor or institutional partner to understand about Cambodia's pharmacy market or Cambodia?
I think there are different types of investors out there. Cambodia is often overlooked because of our small size, right? But I think it could be, I mean, for me, because Cambodia is a third world country, we're still developing, there's a lot of problems. And I think if you overlook Cambodia, you overlook a lot of new startups that could potentially solve really good problems that could potentially expand to other countries as well. So I think that's something that, obviously from an investor point of view, they have their timeline of 5 to 10 years or 5 to 7 years where they have to exit, right? And looking at Cambodia, you can't exit multipliers of 5 to 10 times. You have to think regionally, right? So I understand where the investors are thinking are coming from. On the other hand, there's investors that are focusing more on impact, where patients count is what they're looking at. So that's a different angle as well. But I think overall, Cambodia, yes, it's a smaller market compared to our neighboring countries, like Indonesia, for example. But if you don't look at us, you might overlook, because there's a lot of problems that we could potentially solve that could expand to other neighboring countries as well. So in a sense, we're a bit more earlier, like sort of. We are a bit more. I guess what I'm trying to say is maybe there are a lot of startups that could solve really good problems here that you could maybe pick and invest and then groom them and then grow beyond the Cambodian market. That's what I'm trying to say. And I believe that investments should go beyond the capital, beyond the money that you put in. Because what we really need here is, yes, the capital to fuel the startup, but also the mentoring, the coaching, the technical assistance that you also have to provide, so that you could kind of guide us also that, hey, look, what you're doing is really good. It drives a lot of impact. You solve real problems. But think beyond that. Can we move that into a bigger market, for example? So I think we want investors that are thinking more along that line, rather than, hey, look, I'm going to put in X amount of dollars in you. I want to see that growth. I want to see that 5 years return, 10 years return. That's obviously is one of the things that we also look at. But I think beyond that capital, you should also add support to the startup as well. In any country, it's not only in Cambodia, right?
What does partners like Sanofi get from working with us that they couldn't get anywhere else?
Yeah, I think we're super lucky to have an investors like Sanofi on our cap table, on our portfolio, because this is a true example of going beyond the capital, right? So they put money, but beyond the money, they also add technical assistance, added extra values. They take all the lessons learned that from all their startups that they invest in, all the investees. And then they really kind of tell you like, okay, here's what, we've learned that these are the common trends that you guys are making mistakes. They don't really tell us what to do. They just tell us these are the things that, that they see. And then for us is how do we take that and turn it around or make changes to fit the market that we currently have, right? So I think beyond capital, they add extra values in terms of technical assistance, they add coaching, they add mentoring, and I think this is an example of how investment should be into a startup. At the end of the day, we need money to grow, but we also need coaching, mentoring, access to networks, access to experts, right? So, for example, Sanofi, their team from their commercial side would volunteer their time to coach us on procurement, to volunteer their time to coach us or answering questions on warehouse or logistics, right? So I think these are just beyond what we're asking for, and I mean we don't ask that from all the investors that are going to come in later down the line, but it would be very helpful to get supports like that. And again, different stages of the startup, different needs, different support. So I think beyond the capital, we're also hoping that the investors could also bring value added to the startup as well.
Final question, is there anything you wanted to say and what is the call of action?
What do I want to say? I think a lot different angles right here. So if we're looking at startups, other startups starting from Cambodia, I would say, be quite lean, think beyond Cambodia market, think regional from day one. What does that mean, right? So when you build a product, can you grow and scale out of your own country? So that because we're solving real problems in a smaller population, and the biggest challenge is how do you take that product that you build and be able to scale and grow beyond your own country. So that's would be the message to the startup, right? For investors, I think don't overlook Cambodia as a market. It's a really good pilot market for a lot of new startup ideas as well, because we have a lot of problems that we could potentially expose ourselves to. So the solution that we offer potentially could grow and scale to other countries too. So when you invest in an earlier startups in Cambodia, of course the valuation will be lower. You may have a better chance, a return in the next 5-10 years. So I mean, don't overlook us, right? And beyond the capital, what we're also looking for is technical support, technical assistance, added values to the startup. Because at the end of the day, if we all want the same thing, right? We all want to grow. You want it to get your returns, but we also want to drive impact. So add all that together, align in terms of the North Star, the vision and the mission, and then we all grow together faster, right? And then from the angle of startup as well, but we're finding the right team to be able to help you navigate through a lot of challenges is definitely something that I don't underestimate at all. I mean, this is a very complex, unique team at the end of the day to deliver, to execute the ideas, to execute things that we want to solve, right? And I think we think we have the best team, but obviously we could always improve ourselves. And that's the beauty of startup, right? You're always learning something new. You're always doing something that no one's there to do. It's always difficult. I mean, if the task is easy, we don't do. If the task is difficult and it solves real problems, drives impact for the patients, we would love to take on that challenge. For example, we're working with Swiss Re on new projects to really help turn the pharmacy into a health care hub that they could deliver more patient cares for our community, especially in the rural and provincial area of Cambodia, where access to medical care, access to quality care isn't there, right? So I think we're doing something that's very difficult to do, because you have to change the behavior of the patients, that they now could go to a pharmacy to get screening done on their diabetes, the blood pressure. You also change behavior of pharmacists, that now they become the caretaker for millions of patients, right? So, I mean, these are just some of the things that we're super excited about, because it's not an easy thing to do, but we know that if we could do it well, we could drive, a lot of impacts for millions of patients, and potentially that could replicate in other countries as well, like Myanmar, Laos, or even Indonesia, because I think the ASEAN country, we have very similar problems in terms of healthcare, very fragmented. Healthcare is not equal, and I think for me, especially coming from a public health point of view, coming from a healthcare point of view, we always want to serve our patient better, our population, our country better, and I think to find that angle of how to leverage the pharmacy so that they become the point of care for millions of patients. That's ultimately, going back to your question about where do we see ourselves in the next 10 years, I think that's it. See the pharmacy as a point of care at the center, where all the healthcare access are going through there, connectivity to everyone else in the city, from the province to the city, leveraging technology, obviously, because technology is sort of the middle man in the middle here that could solve problems. Yeah, I think that's potentially what we're aiming for. I don't know anything else.
From the operation side point of view, just want to make the CEO dreams come true. So he's focused on, actually we want to take care of our patients. It's just like the patient is too broad for us, so we want to focus on pharmacies. Because in Cambodia, all the patients will go to pharmacies first. So PillTech just want to be ready to taking care of pharmacies very well. So that's why we built our platform, built our ecosystems like POS system, also CPD, which we want to provide a better training to our pharmacies, making them more professional, and also help their business operations. So from our side, from the operation side, we want to make sure that our pharmacy have enough stock. They can order on our delivery on time, so they can get the product, so they can have enough stock to supply to the customer, to their patients, so they can, and also at the same time they have more time to take care of their patient, rather than meeting multi suppliers, so they don't have enough time to take care of patients. So that's our vision and mission. That's simple, but a long way to go, and we have a lot of room to improve.
Yeah, especially from the tech side as well.
Yeah, sure.
Yeah. So I think soon we're launching our new apps, and the new apps is basically it's not really a new app. It's just basically upgrading our whole system, right?
Yeah.
True.
From inventory to procurement to sales team. We're very excited to announce that it's coming soon. So hopefully it will help drive more impact, increase efficiency within the internal team, our own team, make it easier for pharmacy to find products, to reorder products, drive more values for them. So we're super excited to work with our early adopters again, to test and pilot. Again, startups is all about innovations. It's all about testing new things, and sometimes it's reinventing the wheels at some point, but rebuilding tools, rebuilding technologies to ensure that the users have, our pharmacy customers in this case, have proper tools, so it helps improve their day-to-day operation, so that, like Sina said, right, have more time, quality time with the patient. And that's ultimately what we would love to see.
Thank you everyone so much for today's talk, and this is it.
Thank you.
Thank you.
Thanks for having us.
Thank you.
Thank you.
Bye bye.
Bye.